Hi, and welcome back to Rebel Health. I am Dr. Ellen Vora, a holistic psychiatrist based in New York City and currently in Auckland, New Zealand. And I want to talk about my pet theories on how you manage bipolar from a more holistic perspective. And I don't really want to speak to whether or not someone with bipolar should be taking mood stabilizer medication. That's a separate conversation. But I want to at least arm you with the tools for how you might augment or substitute that treatment approach with a holistic treatment approach. So I've always thought that bipolar is kind of like cousins with seizure disorder. If you think about it, the same medications are often used for both. Mood stabilizers are also often anti-epileptics. And there's even a sort of similar quality in how the brain almost gets tripped into this altered state. In epilepsy or in a seizure disorder, it's tripped into a seizure state. In bipolar, it's more like being tripped into a bipolar episode, tripped into a mania, or tripped into a really deep depression. So I take some pages out of the seizure disorder playbook and I use those in managing bipolar. For me, the number one primary one is actually sleep. And sleep is kind of this throwaway term we toss around and people talk about it casually, a lot of lip service around sleep. With the holistic approach to bipolar, you cannot mess around. This is like the circadian rhythm therapy or social rhythms therapy. I find that my bipolar patients need to get to bed early. They need to wake up early on a consistent schedule. They need to get plenty of sleep, and they need to be pretty cognizant of the ways that they are seeing light, particularly in the evening. I tend to think that patients with bipolar are particularly sensitive to artificial light. So when they see artificial light in the evening, it kind of jazzes up their brain and gets them very triggered and stimulated and wanting to stay up later. So go take the extra step to wear orange plastic glasses to block out that light, or dim the lights in your home in the evening, or even turn off electricity and use candles until it's bedtime. Close out the evening with a bath or a shower by candlelight, but simulate the savanna conditions whenever possible, that you're not seeing artificial lights after sunset. And of course, you also want to see bright light in the morning. So that's the sleep piece, and light is a part of that. Blood sugar is another big one. With seizure disorders, we know that blood sugar, really catastrophic blood sugar dips can even be pro-seizure. And so with bipolar, I find it's also true is that the more stable you can keep your blood sugar, the more stable your mood. So for some of my patients, they just get better at eating a more paleo template diet, so it's a more blood sugar stabilizing way to eat. For other people, they bring a baggie of nuts or packets of almond butter around with them and they snack on that throughout the day. Some people have a spoonful of coconut oil throughout the day. Some people even do a cap full of something called MCT oil, which can be particularly stabilizing for the bipolar brain and also helps with blood sugar. With that, you want to start slow, or else you will get stomach cramps and you will not be happy about it. So start really infinitesimally slow, like start with 1/4 of a teaspoon, and then you can work your way up to things like a teaspoon, half a tablespoon. And then that's the blood sugar piece. Magnesium is interesting. We know in preeclampsia, you want to be giving IV magnesium to prevent a seizure. I think it's true with my bipolar patients as well. A lot of them feel more stable and are less prone to bipolar episodes when their magnesium stores are higher. I like patients to take kind of an uncomfortable amount of magnesium. So it's not an easy pill to take. It's a mineral. It's hard to make it into a small pill. So these are like big horse pills, and you got to take a lot of them. But it is worthwhile. So get a good quality magnesium glycinate from a brand like Integrative Therapeutics or Metagenics or Pure Encapsulations. I have no affiliation to any of these. They're just all good quality supplements. And usually the pills come in 120 milligrams, and you're going to want to take something like 600, 800, even 1200 milligrams at night. And that will help stabilize your brain as well. And then a last piece is just avoiding the things that destabilize the brain. So that's a lot of things. Alcohol destabilizes the brain. Benzodiazepines destabilize the brain, although if you're already dependent on them, trying to decrease your dose or withdraw from them will be particularly destabilizing. So you'd want to work with a practitioner to do that comfortably, gradually. I find that for a lot of my bipolar patients, gluten is actually pretty destabilizing to the brain. There's another topic on that, which is that there might be some relationship between gluten consumption, autoimmune attack on the thyroid, and bipolar episodes. Sort of a discussion for another day, but yes, if you have thyroid issues, that's a big aspect of your bipolar illness. Sidebar on that is that I think many people with bipolar actually just have a diagnosed or undiagnosed thyroid condition, and it's really the thyroid hormone swings that are driving the bipolar episodes. So in your state of relative hyperthyroid, that's more like a mania, and then a state of relative hypothyroidism, that's more like a depression. So avoiding these things that are noxious to the brain, that destabilize. Blood sugar crashes, gluten, for some people dairy, alcohol, benzos. And then I think that just the more you can actually live a sort of steady Eddie, simple, very consistent life that ends up being helpful. Usually that's absolutely the opposite what bipolar patients want to do. But if you're really committed to taking a holistic approach and keeping your mood as stable as possible, and it's like you're motivated, you want that, then it's worth it to start to pare down your life a bit, keep things a little simpler and a little more consistent. So I hope that's all been helpful, and we'll see you next time on Rebel Health.